So a few days ago, I posted an Insta story about thyroid health and signs and symptoms of a hypothyroid or an underactive thyroid. And there was quite a few private messages about it from women who are wondering whether or not they have this imbalance. So I want to just explain a little bit more about what I mean and what can be done for you if you are suspecting a thyroid imbalance. So when you go see a naturopath, we test or we give you a requisition from Life Labs for a thyroid panel. That blood test includes TSH, T3, T4, and thyroid antibodies. A lot of people just going to their GP or their family doctor are just getting TSH covered because that is what's covered under MSP. And if that value is normal, they won't do any further investigating into the thyroid. But the reality is a lot of women have a normal TSH, but potentially an abnormal T3, T4, or thyroid antibody, and they just don't know because they're not often tested or checked. Hashimoto's is a very common example of an autoimmune condition of your thyroid, a hypothyroid condition where you do have positive antibodies, but if the antibodies aren't being checked, you don't know that you have that. And then also with that said, a TSH, the reference range, can be so big that you will probably fall within normal, but start having symptoms at a number that we would like to see as naturopaths a little bit lower to be optimal. So in my opinion, an optimal TSH is 1.5 to 1. That's what I feel where people, both men and women, feel the best. They have energy, their metabolism is working, they're sleeping better, their thermal regulation is great. That's an ideal TSH, even though by requisition standards or reference range standards, a 3 or a 4 is considered normal. A lot of people are symptomatic at 3 or 4. So there's two separate issues. One is what we do for testing and treatment as naturopaths, and then two, what is considered normal versus optimal when it comes to thyroid. With testing, it's really important to know the function of your thyroid in how it requires T4, T3, and cofactors. So zinc, selenium, iodine, B vitamins, those cofactors are responsible for the signaling of inactive thyroid or T4 to active thyroid or T3. And if you don't have substantial cofactors, then that conversion isn't going to take place and you might have thyroid problems. So again, conventionally, Synthroid is the treatment of choice for a hypothyroid, and there's nothing wrong with Synthroid at all. In fact, a lot of women and men are on Synthroid, but Synthroid is solely levothyroxine, which is T4. And for a lot of people, that is missing the whole other piece of the puzzle of T3 and cofactors. So an option is potentially desiccated thyroid or armor thyroid, where you're getting both T4 and T3 and getting on some cofactors to help with that transition. So I guess, that's just a piece of starting, like just a tip of the iceberg of what we can talk about with endocrine health or hormonal health. But thyroid is such a common imbalance for people that if you are feeling tired, like really tired, losing your hair falling out or thinning or baldness more than normal, weak and brittle nails, dry skin, constipation, weight gain, inability to lose weight, feeling cold all the time, especially your hands and your feet are cold, those might be signs that you have a thyroid imbalance. And I would recommend coming in and talking to a naturopath about checking your thyroid with a simple requisition, going to Life Labs and seeing your entire panel. And then once we have that, potentially treating you with some other medication or natural supplementation to help your thyroid.